Hi there, I'm Dr. Elena Sherwood if we haven't met before. Today I'd like to talk about a hidden reason that couples are having trouble sometimes and they have no idea. Obviously it's hidden and why that is. Um, Quite often I talk about how the number one reason relationships break up is loneliness. But sometimes we don't really think about what is behind the loneliness. When I say loneliness, it's the loneliness that exists between two because something isn't right, something doesn't feel good. And it's the slow disconnecting that happens over time. What often happens is one or both may be suffering from undiagnosed depression or depression like symptoms. And I can say this because I did quite a bit of work with the mental health clinics, especially when I was in Alberta. And a lot of the times, I saw relationships where really the underlying thing is one of them really needed some help. And so today I want to talk about some of these symptoms that you or your partner may be experiencing that affect your relationship. Okay, I know it sounds kind of, oh, but I'm not depressed. I'm not really, but the thing about depression and the thing about undiagnosed depression is we rarely think it's depression. And I could say this because I know what feeling depressed and being clinically depressed, diagnosably depressed, feels like. And the last thing I would tell you I was depressed. In fact, if anybody told me, in fact, I actually did have a physician who told me, Elena, I really think it's time for you to maybe get on some antidepressants. This is especially after I gave birth to both my boys, one at a time, sort of that there was a difference there. And I was like, no, 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 there's nothing wrong with me. I don't get depressed. And so I quite literally ignored him. And it wasn't until much later that I just really needed to recenter. If you're here, please say hello. It's always hard to go through that for the first time. Absolutely. Absolutely. And whether it's the babies that's hard, hi, whether it's the just the hormones that are changing. You have to remember too that sometimes our egos get in the way, right? I was like, I'm sorry, I'm a mental health therapist. I'm educated. I know about this stuff. I don't get depressed. What? Actually, my doctor said, if anything, it's you helping professionals who are the worst because you can't always connect what's normal for everybody to yourselves. Anyway, so I just want to make sure that I do a little bit to educate you. And I'm glad I have some folks here. Feel free to ask also if you have any questions about relationships. I'm a relationship educational channel. I was a couples therapist for 35 years, and now I am doing education and consulting. I have a question. Awesome. Please feel free to ask it, and I will do my best to answer it if I can. So thank you. I'm glad you're here. You know what? In the meantime, while you're gathering your question together, I'm going to get started on talking about probably the number one symptom that goes undiagnosed because it seems normal is irritability. Irritability, which means also being impatient, which means being quick to anger, which means being intolerant, which means being stubborn, which means so many things where you're just so moody. You can go up and down pretty quickly, mostly down. And when you're up, you go too high. We're not talking bipolar, that's something else different. We're just talking about moods that come up and down. You can well imagine what it's like to be married to somebody who's experiencing that. Guess who the target is going to be for all of that dissatisfaction? You. All right, I'm going to pause that and I'm going to answer the lovely question we have here. How do I continue to make my boyfriend happy even if we don't see each other for months at a time? Ooh, that's a big one. I'm guessing, are you in some sort of either a long distance relationship or you're just very busy? But whatever it is, doesn't matter. Okay, excellent question. I'm going to read it again so I can absorb it in my head while I'm also forming your answer. So I'm so glad you're here. I'm 16 and we live 30 minutes away. Okay, so it gets a little bit tough. All right, how do I continue to make my boyfriend happy even if we don't see each other for months at a time? All right, the best thing you can do is just stay connected, not always on the serious stuff, but also on the fun side. Not always, I mean, you should be talking about the important things like how you feel about each other, and I'm sure you miss each other. But don't overthink this. But it's hard. It is hard. All relationships, no matter what anybody tells you, they're all hard. They all come with all relationships come with some ups and downs and some challenges. So right now, it might be that the distance, it's not so easy to get together. And another one might be he has to get called away, or you get called away, or you're really busy and you've got all kinds of other things happening in your life and there's just no time. There will always be something. So my suggestion is don't overthink that this distance is a big deal, but also concentrate on just asking each other more about how you're doing. People love to be seen and to be heard. People love it when people listen. People love it when people pay close attention to the things they're saying. So I invite you to do that, check in. And when you are together, whether it's by FaceTime or whatever all the apps are out there, concentrate only on them. Don't do other things while don't have other people around. Don't be, just kind of be present in the time that you do have together, especially obviously when you are physically together. Let me know if that helped, and feel free to ask more questions around that if you could use some clarification. If that helps. Let me know. Let me know. Heart, tap, tap, whatever. All right. So I'm going to talk more about the depression and how it affects the next. Okay, I'm going to talk about the next symptom. Sorry, you guys. All right. The next symptom that often is uh, affects a relationship that people don't know about is having a limited amount of energy and concentration, which means things they may normally do, they don't want to do. Things they hate to do, they're really not going to do. And so you have to be really mindful that sometimes somebody isn't giving you a hard time. Somebody is just having a hard time. Okay, will you answer question about friendships? Or is that not your forte? Relationships are more for my forte. I will help with friendships as well. Of course, yes, I do. They're all kind of the same, even if they're different. That makes a lot of sense, right? Okay, please do ask though, because I'm glad you're here. All right, the next one is okay, sometimes you'll hear, okay, back to relationships and depression. Sometimes you'll hear somebody just really put themselves down a lot and they're just sort of feeling like, um, I don't know, I can't do this and I'm not confident enough there. And oh, I hate my body and I hate how I look and all of that, which is sort of a sign of decreased self esteem. Guess what? It's a sign of depression like. So you may not be actually diagnosable, but whether you have all of the criteria or even just a few, sometimes one or two of those is enough to make your life miserable. So if your partner is putting themselves down, don't be impatient to say, what's wrong with you? Oh my, not this again. How many compliments do I have to give you? Like, no, just kind of respect that they could be struggling with low self image as a result of that symptom related to possibly depression. So when couples become impatient with each other, this is where they get into trouble. All right. And okay, I'll get to your question right away. I'm just gonna finish off the couple more things that I should also. Okay, Elena, focus on one thing at a time. All right. So the other one is obvious signs for depression that your partner might be going through, that you might be going through. Up and down of appetites, or really up or really down. Sort of like you're eating too much and like you're trying to feed some sort of impoverished something happening inside of you and you're using food to console. So that might be a sign, or you just don't want to eat. And so, of course, if you're not eating and you wouldn't have any of that energy. And the other thing is sometimes people will have they'll go to a doctor and the doctor will say, there's nothing wrong with you. I don't know what's wrong, but it ain't this. So physical symptoms that do not seem to be diagnosable may be part of depression. So be very kind. All right, here we go. I'm going to answer the question. So I lost all of my friends over the course of the past 4 months, and I don't know what to do. I don't have anyone who really wants to be around right now. How should I get back to having friends? Also, I'm homeschooled. Okay, so that might pose some problems, seeing how you might be sort of less out there than maybe other people. Don't overthink that either. Um, What's going on with your other friends, by the way? What do you mean they've lost? Like they moved away, or they're just no longer available? Something's going on there, probably, eh? But don't overthink that either. See, the other thing to remember is friends, sometimes we go through cycles with them. Sometimes they come in and out of our lives, like things will change. You have a lot in common. And then you might find that suddenly, you've outgrown, but then they may circle back, right? And so, again, be very kind to yourself that way. Also, see if there are any decent things you can do online. They started going to school and they are online, which makes it hard. Oh, I get it. Can you still keep in touch with them though, even online? Because if you at least have some kind of basis for a relationship, friendship, some things in common, maybe you can at least have some sort of relationship there. Okay, I do my best. Oh, good, good. I love that you're doing that, and I love that you have a positive attitude. At least I'm getting the idea that you have a positive attitude about it. And so continue with that. Keep trying. If they're not responding, don't take it personally. Try again. Don't be a pest about it, but just keep the lines open. Check in once in a while. And again, the same thing as with your boyfriend, ask how they're doing and really doing. And so keep that up as best you can. And obviously, I've already said it, don't take it personally. The other thing too is find other, maybe I know that there are a lot of other groups now, or a lot of, I know for Facebook groups, especially. Oh my goodness, I'm in about 3 or 4 of them that I just absolutely love because we have so much in common. And so try the other different ways. The other thing too is, are you able to get a part-time job? That might be difficult, I know, but that's also another place that people end up developing friendships. But again, just keep trying and don't be afraid to initiate if you haven't heard from them in a while. My parents don't want me to. Oh, I got it. I gotcha. I gotcha. It could be really distracting, but that's okay. Just again, do what you can with your friends. Don't overthink it and just be calm in that things will work out the way they're supposed to. I hope you have all found this helpful in some way. Again, Dr. Lena Sherwood, if you enjoy my content, feel free to subscribe or email me if you have questions, and I would love to answer them if they're within my purview. Thank you again. Thank you, and you are welcome.